Casualties arrived in their thousands. Medical facilities had been destroyed or completely overwhelmed. January 2010, east of Port-au-Prince was a disaster zone. Urgent action was required.
In the hours following the earthquake, we knew we could save a lot of the wounded, but an operational structure had to be set up as quickly as possible.
MSF decided to send an inflatable hospital. In Port-au-Prince, we located a suitable site in which we could set up tents for dozens of casualties. Then tons of equipment had to be brought in.
There's the structure itself, the inflatable tents, the water supply and drainage system, the electricity network, and they all have to be set up right away.
Over the next 4 days, MSF logisticians worked tirelessly, right up until the first patient was admitted to the operating room. An emergency situation or not, our logisticians have to be able to handle all aspects of a project.
And this can include finding medical structures and the team's accommodation, and bringing in supplies from outside the country. It also involves setting up all the technical aspects, such as water and electricity.
Flexibility is our motto, and not being afraid of getting our hands dirty.
Transport is fairly strategic, as equipment, staff and patients need to be moved around. We have to be able to rely on a fleet of vehicles, because otherwise the team's work might be slowed down or even temporarily suspended.
The cold chain is also strategic. Vaccination campaigns are an essential part of Médecins Sans Frontières' work, and keeping vaccines at the right temperature is vital to their success.
The cold chain and transportation are the two main priorities in a vaccination campaign. This means installing fridges and freezers and ensuring that there are no electricity outages to disrupt the cold chain, and providing transport for the teams, equipment and vaccines.
While experience shows that most logisticians need to be generalists, problems in the field sometimes demand more specific expertise, and this is where MSF experts step in.
The main areas of expertise are water and sanitation, energy, biomedicine, construction and vehicles.
The work of these experts starts well upstream, as they decide which equipment is required in the field. It needs to be as easy to use as possible.
For example, field tent hospitals have plug-and-play electricity, so that a non-specialist logistician can install them unaided.
Once the equipment has been assembled and sent to the field, the experts are often called in.
Experts provide periodic technical support to staff in the field and set up customized on-site training for logisticians.
One of the priorities of logistics is to set up a quality water supply to enable hospitals to function properly, for example, or in refugee camps.
Displaced people are often susceptible to poor health, so we have to treat water and make it clean so that their condition doesn't deteriorate still further. We estimate that 20 litres of water are required per person per day to meet basic needs.
Flooding in Pakistan in August 2010 left tens of thousands of families homeless and without access to water. Ideal conditions for the spread of numerous diseases. Wells, tanks and tanker trucks were used to supply water to those most in need. Our principal objective is to adapt to the places where our patients are and provide the medical teams with the best conditions possible to facilitate their work.
When we'd finished setting up the health facility in Haiti and it was ready to admit the patients, we saw them beginning to arrive. It's so satisfying when you see the surgical units are ready and that people are going to be able to benefit from a decent hospital infrastructure.